Hi, this is Dr. Tina. I'm here with you today doing your tutorial as you prepare to learn how to utilize the Wiley Protocol for your rhythmic cyclic hormone replacement. You are going to need three things in order to make it through this tutorial. I need for you to print out a copy or have a copy of the plan that was emailed to you after our initial consultation. So that will be in an email to you. I also need you to have present a copy of the lunar calendar for the month that we are in. That was also attached to the email that you received from my staff, and it would probably be included in the mailing from the pharmacy. And then lastly, but not least, I want you to have available one green packet and one purple packet which contains the hormone product that you received from the compounding pharmacy. Okay, so to get started, again, this is called the Wiley Protocol. This is a rhythmic cyclic hormone replacement. It is all cream-based. In number one, it will give you the pharmacy that I have used for your individual mailing. Okay, I use different pharmacies all over the country depending on where you live. So your specific pharmacy will be listed in number one of our instructional. And hopefully you have your product all delivered to you before your start date, which should be very soon. Okay, number two is the actual start date for the hormone protocol. All women starting the protocol in this month will start on the same day. Remember, this is a lunar calendar, so it's the same start date for all women. Number three is going to talk about your dosage. Now, your dosage is very specific to you. So it will tell you your estradiol or your green packet will start at such and such a dose, and your progesterone or your purple packet will start at a particular dose. All right? So I'd just like to go over the packets since we're talking about the actual packet itself and the dosage column. So as you can see, sometimes the pharmacy will take initiative and circle your dosage, okay? Your dosage is reflected always in the vertical column. So you have a host of vertical columns there, and your particular dosage, be it W or W+1 or W+2, is your dosage column, and that is read up and down. So the dosage is the vertical column, and your instructions are actually going to be read horizontally. Your particular dosage will be listed in your instruction sheet. And just as an aside, also I want to just bring to your attention, whenever you're starting the cycle, the dose that you start with is always the dose that you're going to end with. And that is called your baseline dose. That's really important because we will refer to that. So if you start with 4 lines of green, you will end with 4 lines. Same thing with the purple. If you start with 4 lines of purple, you will end with 4 lines. And that is considered your baseline dose. Okay. Estrogen is used every day. It's used from day 1 to 28. Every day. Estrogen is a woman's fuel. It's her main hormone. Progesterone is only used on days 14 to 28. Very difficult to goof up on this because as you read your instructions, it'll say apply, 5 lines twice daily on days 14 and 15. And I know you're thinking to yourself, well, how do I know what day 1 is? How do I know what day 14 is? You will know because we have calendars that will guide you through, okay? Progesterone is used on days 14 to 28, unless a period appears before day 28. If a period does appear before the final day of the cycle, you simply stop the progesterone, and that then becomes your new day 1. So your first cycle has been completed, and you're now starting your new cycle. We never use progesterone during a period. Okay, so again, just to quickly recap, estrogen is every day. It's for the full 28 days. Progesterone is only for 2 weeks out of that 28 days. So it's day 14 to day 28. Okay, next. Until you develop a period, you're going to follow your lunar calendar very closely. Lunar calendar is going to be your friend for the first month, and for some women, it's every month, but for most women, it's the first month until they develop their own period, okay? On the lunar calendar, a baseline day is where you can do your baseline dose of estrogen. Okay, so I think what I'm gonna do right now is I'm gonna walk you through a calendar. So you see a photo of the March 2020 and the April 2020 calendars. And I want you to just focus on, we're going to focus on the April cycle. Well, the April cycle actually starts on March 28th, if you look at the calendar that's there in front of you. Obviously, the calendar that you're going to be using for your current month is going to be different as this is taped. But this is just an idea. So your day one starts on this calendar that you have in front of you, March 28th, and you can see that it walks you through day one, you know when day two is, day three, day four. Now we move into April. The 1st of April is day 5, and it walks you all the way through. Day 12 is the 8th of April. That tells you that it's a full moon. And it walks you all the way through down to day 28, which is the end of the cycle. Okay, and so this is exactly what you need to understand the instructions that are on your packet. All right, once we get to day 28, you're following this calendar very, very closely. Okay, you can see that after day 28 there is a baseline day. A baseline day is a day where you can do your baseline dose of estrogen, because remember, now you have finished your cycle, so there's no more progesterone. So you're going to do your baseline dose of estrogen, or you can choose to do nothing. And you have the option to do that. So if you're really not suffering from hot flashes, if you are, really not suffering from intense brain fog, and you're really having very mild symptoms, you might choose to do nothing on that day. And that's perfectly fine, and that is something that you and I can discuss personally. You can contact me if you have any issues regarding that. So once you develop a period, you're no longer going to follow the lunar calendar. So let's just say, for all intents and purposes, you finish day 28, and the next day, on that baseline day, which would be the 25th of April, you get a period. Well, that's fantastic. That's almost what is expected. And so what you're going to do is that April 25th will now become your new day one. So you're going to go to your personal calendars, which was provided to you, again, in my email or provided to you by the compounding pharmacy. And you are going to take that regular personal calendar, just a blank calendar, and mark number 1 on April 25th, and then you will continue to number the calendar days all the way up until day 28 as you proceed into your next cycle. Let's just say, again, that you develop a period on day 28. Let's say you never make it to the last day. You wake up in the morning and you have a period. Well, then that day becomes your new day 1. So whenever you have the period, that becomes your new day 1, okay? Hopefully that was really very clear. If a woman has had a hysterectomy, okay, or a serious ablation of the uterus, she may never get a period. And so she will always be, that woman will always be on the lunar calendar. And so it's actually very easy to just follow. But for those of you who will get a period and who do get periods, you won't be following the lunar calendar. I have a few women who are, for many years, have remained on the lunar calendar like clockwork, but there are not many of them. Okay, so ideally, we're at number 6 now. Ideally, a woman should have a period on day 29 of her cycle. That doesn't always happen. A period that appears on or between day 25 and day 31 is something that I consider to be very normal and within proper range. Once you have launched onto your own personal cycle, once you've made it past the lunar calendar, I ask that you wait 2 days after day 28 should you not get a period. So you would wait day 29, you would wait day 30, and then on day 31 you would start your day 1 for your next cycle. Even if you should get a period within the first 5 days of starting that cycle, you just keep on going. And again, I'm going to be locking arms with you. I'm going to be holding your hand through this. And so you're going to contact me with any questions, because this does sound very confusing right now, but I guarantee that you'll be sailing through this no problem. Okay, so we're done with number 6, and we're pretty much done with the calendars, and I can always review this with you personally if need be. All right, so now we're going to talk about the creams. So, purple packet comes with purple syringes. Your green packet comes with green syringes, and how wonderfully coordinated that is and simple, because if you drop your packet and the syringes come flying out, you know exactly what canister they belong to, what Mylar packet they belong to. So all of your creams must be applied twice daily, okay? Preferably 12 hours apart. If and when you forget a dose, you're going to apply that dose as soon as you remember. It happens to the best of us. Worst case scenario, you can apply a missed dose with your next scheduled dose. I want you to keep your packets really very visible, okay? So you keep these by your nightstand, you can keep it by your toothbrush, you can, put it wherever you think, in your refrigerator, wherever you think you're going to avoid forgetting it, okay? The other thing that you can do is set your phone or set some sort of a calendar alert to remind you to put your creams on twice a day. It really is that important. Okay, so what I want to do is just do a quick walkthrough on the actual syringe. You're going to have a photo in front of you, and you can see that the syringe comes filled with 3 mLs of cream product. And you're going to gently push out the indicated amount with every dosing. So when it says push out 4 lines, essentially from number to number, so every numerical, so from 2.5 to 2, 2 to 1.5, every numerical is 5 lines. So when it says push out 4 lines, you're just going to gently push the plunger until the top of the green or the purple plunger reaches that 4th line. So if it's 4 lines, you're going to, and then from that 4th line, you're going to push out another 4 lines. Really very gently. What I don't want you to do is take the syringe and just push it through, because I guarantee that it will come flying out. It doesn't have a black stopper on the inside, so sometimes it does jam. So I just suggest holding it this way and sort of simply guiding it through into your fingers and just pushing it through. You will get the hang of it immediately. I have no doubt. Okay, so now that we've gone through the creams and we know how much we're going to put on, we're going to talk about application sites. So I've given you 2 options. So we're going to do estrogen on either the inside of the arm, sort of the soft fleshy area between the armpit and the elbow, or you can also do it on the inside of the thigh, the inner thigh. So from the pubic area all the way down to the inside of the knee. So you would do estrogen on one side, progesterone on the other. I realize that when you get these packets delivered to you, there are instruction sheets that come directly from Wiley Protocol, and they will say you can easily apply the purple and the green creams together. I do not suggest that you do that, for the simple reason is that if you're busy, if you're in a rush to get to work, if you're on the phone with one of your kids, you'll be applying your cream and you'll be so engaged in what else you are doing that you will forget if you've put both creams in the same location. So I separate the creams this way. You can feel where you've put the first cream on, you can feel where you've put the second cream on. So been there, I've done that, I've experienced it, I live this, so I would suggest that you use opposite. So estrogen, progesterone, or estrogen, progesterone, thigh and arms. Okay, option number 2. You can apply progesterone to the upper part of the abdomen, sort of right under the breast area. There's a lot of surface area there, and you've got a lot of place to sort of smooth it around. And you can put estrogen on the neck from the jawbone to the collarbone, which is nice, ample area to do that, okay? I certainly suggest that you start with option number 1 and then move to option number 2 once you really have gotten a handle on application and sort of remembering. I ask that you stick or be consistent with the application sites within a cycle. If you choose to change, wait till your cycle's finished and then start with the new cycle. Number 9, you are going to need non-fasting blood work in your 3rd or 4th cycle. The blood work should be done on either, and this is important for your first blood work after starting, should be done on either day 12 or day 21 of the cycle. I give you 2 options. You can do it in your 3rd cycle or your 4th cycle. So let's say day 12 falls on a Sunday or or a holiday, and as does day 21, or you've got some party and you can't get to the laboratory on either of those days, you can toss it over into the following month. But really try to get it done and planned in that 3rd or 4th cycle. My staff will send you a reminder email with an order for the blood work, or whatever the arrangements that we've decided to make for you individually is fine. But you will get an email reminder, so it's one less stressor for you. Okay, and we're really very specific about what we want. It's not a lot of blood work. You don't need to fast for the blood work. You can do it at your primary doctor's office if you're not local, and or we will gladly provide you with an order to do that. I ask, if you have not done so already, to please forward me copies of any recent Pap results, of your recent bone density test, any mammogram or breast sonogram studies that you've had done. I'd like to keep copies of all of that, please. I also want to make sure that when you go to see your gynecologist, that you disclose to your gynecologist that you're on cycled hormone replacement therapy, just to keep everyone in the loop. I want you to schedule all of your visits to the gynecologist, if you're going to be examined, between day 5 and 15 of your cycle. So early in your cycle, certainly not when you're bleeding. So early in the cycle, so there's really no buildup of lining within the uterus. That's really it as far as instructions. Maybe just a little bit of housekeeping. I suggest that when you're done with the Mylar packets, it's really nice to keep a set of these in maybe carry-on luggage, or in your work briefcase, or in your car if you travel for business, or if you just travel a lot in general. Having this when you open up your suitcase is a really nice reminder to pack up your syringes. But more importantly, I can't tell you how many times women will grab their syringes and head out for vacation and then forget their instructional packets. Okay, really important. So this doesn't do any good without your instructions. You can also take a photo of the front of the package and have that and save that in a storage area in your phone, so that you always have your dosing there for you. And I really think that's it for our tutorial. So hopefully this will help you. I know you're going to be getting started in just a few days. Remember, I am available. You can call us at 914-909-2546. If you have any questions, you can email me at tinadiscepolamedical@gmail.com. Again, my staff is also equipped to answer any basic questions. Anything a little bit more intensive, I do tend to get involved with. Okay, and I look forward to all of you starting the Wiley Protocol. So cheers to all of you. Thank you.